I now request His Excellency Prime Minister Oli to make his remarks.
Right Honorable Prime Minister Sri Narendra Modi ji, distinguished heads of state and government of SAARC member states, Namaste and good afternoon. First of all, I would like to thank Prime Minister Sri Narendra Modi ji for taking this important and timely initiative, which I warmly welcome. Our collective wisdom and efforts will help us devise a sound and robust strategy for the SAARC region as we fight the COVID-19 pandemic. I wish to thank Prime Minister Modi ji and all the distinguished leaders of SAARC member states for kind words and best wishes on my speedy recovery. Even though we had detected one suspected imported case, but the COVID-19 test proved negative. Yet we are aware of the high risk of possible outbreak at any time. We remain alert from preventing it. We have taken several measures to enhance our preparedness. Our efforts at the moment are geared towards preventing this disease to enter into our country. Our national efforts, I am personally overseeing and guiding the government efforts. Multi-agency coordination committees have been set up at the center, provinces and local levels to mobilize government efforts in the synergetic manner. We have restricted international movements, visa on arrival facility for all foreigners and non-resident Nepalis with foreign passport has been suspended. Movement of this country, movement of third country nationals via land routes has been suspended. Swab test PRC health certificate is made mandatory to obtain visa from Nepali missions abroad for essential travels to Nepal. We have suspended issuance of work permit for Nepali nationals for overseas employment. International passengers are required to go through the screening process at the health desk at the international airport. There are provisions for self-quarantine for certain categories of travelers. We are strengthening quarantine facilities in all provinces, hospitals, and arranged isolation wards and intensive wards for treatment. We are enhancing capacity of hospitals. Health workers are being provided with personal protective equipment and necessary incentives to motivate them. All the permits for mountaineering expedition for spring 2020 have been suspended and all major international conferences have been postponed. Our region is at high risk of COVID-19. The epidemic knows no boundary, no nationality and no region. Therefore, we need to devise ways to combat this pandemic collectively. It is a common challenge and it demands common efforts. First thing is awareness creation. Community-based organizations and medical and non-medical volunteers could be mobilized in raising awareness and supporting government agencies. We have to appeal to our people to avoid non-essential foreign travels and to avoid attending mass gatherings and other large-scale events. Our region is rich in traditional medicine. We have to encourage our people to use this asset for the prevention and treatment of this disease. Our way of greeting people with namaste rather than shaking hands can avoid potential threat of women-to-women transmission of this virus. I believe that our region holds a good stock of emergency medical supplies, well-trained medical professionals and laboratory facilities. These would be deployed at the call of any member state of SAARC in urgent need. The hospitals in the bordering areas could also be utilized for the screening as well as treating infected patients coming from across the border. We may encourage hospitals, medical centers, research institutions and health workers in the region to build a good network for sharing experiences, research findings and best practices in critical areas associated with the prevention and treatment of this deadly disease. We need to ensure a smooth supply of essential medicine, equipment and sanitary materials in the region. We may think of developing a SAARC-level mechanism to deal with critical health issues such as this. Establishment of a SAARC emergency medical center supported by a strong funding mechanism would be desirable. In this regard, I welcome Your Excellency Modi's proposal and India's contribution. Nepal will also join soon in this fund. The economic cost of this pandemic is yet to be assessed. I am sure it is going to cost all of us dearly if it is prolonged. Regional discussion on reviving our economies and supporting each other through providing easy access, establishing value chains and promoting intra-regional trade, investment, tourism and connectivity would be critically important. Thank you, Prime Minister Shri Narendra Modi ji.
Thank you. Thank you, Excellency. Now I call. Thank you, Excellency. Thank you all for sharing your thoughts on the situation and the steps you have taken. We all agree that we are facing a serious challenge. We do not know and as yet know what shape the pandemic will take in the coming days. It is clear that we have to work together. We can respond best by coming together, not growing apart. Collaboration, not confusion. Preparation, not panic. In this spirit of collaboration, let me share a few ideas on what India can offer to this joint effort. I propose we create a COVID-19 emergency fund. This could be based on voluntary contributions from all of us. India can start with an initial offer of 10 million US dollars for this fund. Any of us can use the fund to meet the cost of immediate actions. Our foreign secretaries, through our embassies, can coordinate quickly to finalize the utilization of this fund. We are assembling a rapid response team of doctors and specialists in India, along with testing kits and other equipment. They will be on standby to be placed at your disposal if required. We can also quickly arrange online training capsules for your emergency response teams. This will be based on the model we have used in our own country to raise the capacity of all our emergency staff. We had set up an integrated disease surveillance portal to better trace possible virus carriers and the people they contacted. We could share this disease surveillance software with SARC partners and training on using this. Let us also use existing facilities like the SARC Disaster Management Center to pull in the best practices among all of us. Looking ahead, we could create a common research platform to coordinate research on controlling epidemic disease within our South Asian region. The Indian Council of Medical Research can offer help coordinating such an exercise. We can also ask our experts to brainstorm on the longer-term economic consequences of COVID-19 and how we can insulate our internal trade and our local value chains from its impact. Finally, this is not the first nor the last such pandemic that will affect us. We can also ask our experts to brainstorm on the longer-term economic consequences of COVID-19 and how we can insulate our internal trade and our local value chains from its impact. This can help to prevent such infections from spreading across our region and allows us to keep our internal movements free. I call upon His Excellency President Ghani to share his thoughts.
Well, thank you, Mr. Prime Minister. Thank you, all heads of state and government, and Dr. Mirza. The number of cases in Afghanistan is 16. No deaths, and as of yet, they're in 5 provinces. But the case I make is the following. Our refugees from Iran are being sent back in droves. I would like to make the case that dealing with this flow in the Herat province, 3 provinces, particularly Herat, Nimroz and Farah, is a regional challenge. Because thousands of people are coming from an infected area in the period in which the incubation takes place and the detection takes place. So we would like to offer, particularly the Herat province, where we're making major efforts, as a model. In terms of organization, our National Security Council I've chaired a number of times, and we've created a task force under the Vice President in all the provinces. We are reorganizing our budget, etc. But let me welcome your initiative. We would like to be delighted to contribute to this voluntary fund. But the phases, Mr. Prime Minister, we would suggest we need to think about the next 6 months as one period where the pandemic is likely to unfold. Thank God weather is going towards warming, and it's shown that there are negative consequences. But the vaccine is not likely to develop sooner than a year or to 18 months. During this period, whatever we can do in the way of prevention is necessary, but the second and third order consequences of this on our social fabric, on our economic transactions, and others really requires thinking through. The impact on poverty, which all of us, and you, Mr. Prime Minister, has taken such a leading role in this, is likely to be negative. So how do we think through in ways to be able to protect the most poor and the most vulnerable? Because of that, we welcome very much your task force and ways of collaboration in return to this issue of being able to deal with. The third order issue is, while all these measures, and we've resorted to control of borders, the disruptive impact of this, what are ways to be able to generate economic transactions and activities? And here again, there is need for considerable thinking. We would like to support the meetings by video conference at the ministerial level. We would like to thank the Secretariat for their vital role. But the most important issue is that both pandemics and particularly climate change are upon us, and without SARC coordinating as such, our vulnerability will increase. Once again, Mr. Prime Minister, let me thank you for convening this meeting and for the follow-up actions, and we would always be ready and willing to collaborate and to welcome coordination, learn from the best practice, and contribute to it as this global crisis unfolds.
Thank you, Excellency. I request His Excellency President Soli to make his remarks.
Thank you, Prime Minister. Continents, there is absolutely no room for any complacency. While hoping for the best, we have to prepare for the worst. The World Health Organization's four-pronged advice offers a reasonable way forward, namely A, prevent, B, detect, C, respond, and also D, conduct research and innovation along the way. Excellencies, Pakistan has been involved in containment efforts right from the outset of the outbreak. We have been alert to the dangers and have put in place appropriate public health measures and developed required protocols and guidelines for the safety of our people. We have been matching our measures to real-time risk assessments. While we have stressed the need for prevention and caution, we have strongly advised against panic. A calm, calculated, and deliberate response is the need of the hour. Pakistan was among the first few countries to undertake a joint external evaluation for the state of preparedness to cope with health emergencies in the context of International Health Regulations 2005. In close collaboration with World Health Organization, we have been taking steps to appropriately restrict movement to and from the affected countries, regulate for flights, institute health screening measures at entry points by member states, and establish quarantine/isolation facilities. Diagnosed cases are being isolated and contacts are being traced proactively. Prime Minister Imran Khan is personally overseeing these efforts. Resultantly, Pakistan has managed so far to keep the cases to a relative minimum, an achievement that WHO has recently recognized as a good practice and has commended it. National Security Committee recently convened for the first time on a national health issue, chaired by the Prime Minister Imran Khan, and has decided to take major steps to contain the spread of COVID-19. The 4 pillars of our response strategy include: 1, governance and financing; 2, prevention; 3, mitigation; and 4, communication. We have decided inter alia: 1, to close all our educational institutions for 3 weeks, close the entire western border for 2 weeks, restrict international flights to 3 airports only, and to ban all large public gatherings, and reinforce screening and administrative measures at the seaports and at the ground crossings. The situation is being monitored closely, and appropriate measures are being taken through a systematic consultative review process. The National Disaster Management Authority has been mandated to lead the interagency effort, and command and control centers have been established at the federal and provincial levels. Effective coordination and surveillance at all levels is critically important. Excellencies, the COVID-19 pandemic forces us to think not in terms of nations and states, but as a collective. If our health systems, disease surveillance systems, and preventive measures are unable to cope, the human and economic cost alone can be staggering. The cumulative impact will dampen region-wide growth prospects and negatively affect the national development agendas. At their current stages of development, the SAARC members can ill afford such a setback. The unprecedented challenge therefore warrants an unprecedented response. We must recognize that the national and local responses still remain the key, and they are the most critical. It is equally important to pursue, however, evidence and science-based responses. Stigmatization and stereotyping is counterproductive. The SAARC Secretariat is best placed to coordinate regional endeavors. With this in view, Pakistan proposes, like other excellencies, that the SAARC Secretariat be mandated to: 1, establish a working group of respective national authorities for health information and data exchange, as well.
President of the Islamic Republic is more heartily than the better ones. So we are equally concerned that as we fight and as we try to contain this disease, we are also concerned about the economic outcomes of this disease. So therefore, I would like to support all the proposals that were made before me, and also to be very, very sure that we all will share our limited resources that we have, share the technologies that we have, and also to have frequent such meetings so that with the changes in time and with the changes of the demand of this pandemic, we also come and regroup ourselves. And I also would like to propose that we must have a similar cooperation in economic get up on this issue, because all the smaller economies are disproportionately hit. So with this, I'm sure my other colleagues will have a lot of points to share, and I also would like to contribute as the discussion goes on. So as of now, I would like to thank all the heads of the states and heads of the countries and governments, as well as Prime Minister Modi for your initiative. Thank you very much.
Thank you, Excellency. Now I call upon His Excellency Dr. Jafar Mirza, who also has medical experience, to share his thoughts.
Bismillahirrahmanirrahim, and Assalamu alaikum to honorable heads of state and government and Secretary General SAARC. First of all, I would like to wish good health to His Excellency Prime Minister of Nepal. Your Excellencies, the COVID-19 pandemic is one of the most serious global health emergencies witnessed in the last 100 years. At the same time, when it has been characterized as a global pandemic, it is deemed controllable as well, provided timely and appropriate public health measures are.
We managed to trace the whole path of the first positive case. We managed to identify all the 48 primary contacts. We managed to send all the contact tracers and surveillance team to their respective places and inform them of the importance of house quarantine that first morning. And then as the day unfolded, we managed to pull them out and bring them to the formally identified quarantine facilities. So over 78 hours, we managed to identify all 48 primary contacts from 3 different parts of the country wherever our tourists had visited. And we also managed to initiate the medical team that we had identified to treat in case if he had a positive case. And then he was isolated and treatment started. And it all happened because our health ministry under Minister Dichen's leadership, everything was planned beforehand. And then our king was also awake the whole night trying to coordinate the whole thing and bring all the primary contacts together. So we do not wish to have positive cases in any countries, but to have a positive case in this manner and to be able to identify all the.
Now I call upon His Excellency Prime Minister Dr. Lote Tshering, who is an experienced surgeon. Prime Minister Tshering, we are all keen to hear you. Please.
Thank you, Your Excellency. Before I start, I would like to take this opportunity to convey my king's greetings to all the heads of the states and heads of the governments here. As we speak, my king is out of the capital. He is in the district places, ensuring healthcare services, ensuring COVID-19 surveillance system, and trying to motivate our healthcare services and service providers, as well as asking all the people of Bhutan to be on the same page when this pandemic strikes Bhutan. So with this, I also would like to take this opportunity to express my king's greetings and greetings of all of us to Prime Minister Oli for his speedy recovery. And similarly, we also would like to wish Prime Minister Hasina for our father's 100th birthday celebration in few days. So with this, I would like to thank Prime Minister Modi for your excellent leadership to bring all of us together, because togetherness is required at all times. But when the whole world is fighting one common disease that we cannot see with our naked eyes, I think it's very important that all of us come together and leave behind our differences. And number 2, I think it is very important that we communicate very clearly on this. Communicate between all the leaders of the world, communicate between central government with local government, communicate with the health planners and the people of the nations. So I think this is very timely, and I would like to thank Prime Minister Modi ji for your excellent leadership on this. To tell my colleagues on the experience of Bhutan on the lone COVID-19 positive that we had, it was the 5th of this month, last 5th of March evening, we had one lone imported case. A Bhutan lover, a Bhutan visitor who wanted to visit Bhutan came to Bhutan, and then on the 3rd day of his visit, he showed some very abnormal signs, symptoms, and then on suspicion, we found out that he was COVID-19 positive by evening. yet we wanted to confirm it, and the confirmatory test came just before midnight, around 11:30 p.m. By then, our health officials had all gathered in the ministry. Even my king also came to the ministry, and we all started because we knew that we had the first confirmed positive case. So throughout the night, we worked very